So today I'm going to speak about the healing power of mindfulness, specifically mindfulness in medicine and healthcare. That is the field in which I work. So let's begin first by acknowledging that there's a very close connection between the words meditation and medicine. Sound alike? Yeah? In fact, meditation and medication, only one letter difference. And I can't tell you how often people are writing to me and they get that a little bit off. Anyhow, both come from the same Latin root word, medere, which means to heal or to make whole. Now, the connection between the two words really lies in that shared origin related to healing, but also taking appropriate measures for healing, right? So it's like, also the word means the right measure. So with meditation, the right inner measure, right? With medicine, I'm already interchanging the words. Medicine, quite often, is what's the right outer measure, something to give, to fix something. Okay. Now, there's many definitions of mindfulness. Today, I'm sharing with you the definition that Jon Kabat Zinn has given us, and he's the person who developed mindfulness-based stress reduction in the medical field. And he defines it as awareness that arises through paying attention on purpose, intentionally, in the present moment, with a non-judgmental attitude. Jon is my teacher, a dear friend, and he has a lot of words often, if any of you have read about him. So it's good to kind of simplify a little bit here. And one way to do that is through what is called the 3 axioms of mindfulness, which are intention, attention, and attitude. Right? Intention, to be present. The attention is focused attention on what is happening in the present moment. And then very importantly, from our perspective in the medical field, is the attitudes. It's not just attitude, it's attitudes of curiosity, openness to experience, kindness, compassion. Now, these 3 axioms, they're not linear by any means, even though that's the way it's drawn. They're engaged simultaneously in the process of mindfulness. So it's important to note, which I believe you already know this, but to say that mindfulness is a natural human capacity for being present. We all have this. It's innate. It's an innate capacity. You may also experience that there are times where you're not present. Anybody experience that? Yeah. So while it's an innate capacity, our minds often wander to the past, to the future, to all kinds of places. So it's important to take what's already innate and cultivate it. And that is what formal meditation practice allows us to do. And that's where mindfulness-based interventions come in. And they're involved the training in mindfulness meditation. And that is the core essence of mindfulness-based programs. So the first mindfulness-based program in medicine was what Jon Kabat Zinn developed, which is MBSR. And this was at University of Massachusetts Medical Center in 1979. Now, I want to say to you that Jon certainly knew that the program that he developed and was going to bring in was much, much more than stress reduction. All right? However, he was in a setting where if he were to say, okay, here's a program, emptiness, no self, the odds of patients coming to that type of program, he wouldn't have too many takers, right? But everybody knows what stress is. And people who are going through illness, they really do know that. So that is what he chose, right? And the standard program is an 8-week program, 2.5 hours a week, plus a full-day retreat that people come to. It's very educational. It's really training in mindfulness. The classes support a community of learning. One of the things that we say right away, if anyone wants to take the program, is that we really want them to realize that they need to be committing to home practice. That the classes are only there, actually, to support what you're going to be doing at home. All right? So there's daily formal mindfulness meditation practices that are, that's the essence of the program, actually. And Jon asked for 45 minutes of home practice. There's some shifting through the years, but in general, that's what people are asking. The type of practices are body awareness practices, body scan, awareness of breath practices, walking meditation, eating meditation, loving kindness practice, compassion practices, mindful movement. So a variety of practices, so that some people take more to one than another. But we ask them to do all of these practices throughout the 8 weeks. Now, at the very beginning, Jon was a scientist by training, and he really knew that if he wanted this to kind of move out, that he should do some research, and he did. And some of the early research that Jon did was very, very beneficial and promising. And based on that, there are many other mindfulness-based programs that have been developed through the years. Basically, formatting is the same for many of these, and the core is the same, mindfulness meditation training, but other treatments are involved, and for other patient populations. So MBSR was originally for patients. However, now we have clinical and non-clinical populations coming to MBSR. And mindfulness-based cognitive therapy was originally for recurrent depressive patients. However, now it's for chronic pain, anxiety, and so forth. And there's mindfulness-based relapse prevention and mindfulness-based eating awareness and cancer recovery. And we like to actually ultimately say it's mindfulness-based dash ETC, etc., 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 because there's so much proliferation of mindfulness programs in healthcare and the communities at large. So research on mindfulness has certainly exploded. If you look at the year around 2000 or so, a handful of papers in academic journals. We published our first papers in 2003. Again, just a handful. Now, in 2022, it was over 1,400. Now it's even more. Lots of interest in these programs, in what mindfulness does as far as its benefits, and also how does it actually do that. So I'm going to speak just a little bit about some of the research, because it's, well, you can see 1,400 papers in a year. We could go on and on, but I'm going to just speak with about a few. And this is basically a systematic review and meta-analysis of meditation programs for psychological stress and well-being. And this was in the Journal of American Medical Association, which is a very rigorous journal. And it's 47 randomized controlled trials, over 3,500 people. And these studies were important because they were using active control groups. which prior to this, not everybody had active control groups, which means you don't know whether the people would get better or not, because you don't have a control group. So these control groups, it's in which the amount of time and attention was comparable to that of mindfulness programs. So you're looking at other programs versus the mindfulness-based programs. And the mindfulness meditation program shows significant improvements in anxiety, in depression, and pain in a diverse clinical population, including chronic pain, heart disease, IBS, breast cancer. Subsequently, this has also been shown in healthy populations as well. As far as mindfulness-based interventions in cognitive function, there's certainly mounting evidence that randomized controlled trials indicate that mindfulness interventions can improve attention-related outcomes. And when you think about it, that's what we're doing, right? We're cultivating our ability to stay here and to be attentive. So sustained attention, working memory, as well as effective outcomes, reducing rumination, which, I don't know, any of you ruminate or ever have ruminated before you started meditating? You know, it's, I'll leave it at that. You know what that is. And anything that can help reduce rumination can, alleviate suffering. Most of that work is done in healthy young adult populations, oftentimes college students, that's what I go with the college students. But there is some evidence for improving cognition in cancer patients and patients with mild cognitive impairment. This study says the 8-week mindfulness-based stress reduction program induces brain changes similar to traditional long-term meditation practice. And this is a systematic review. So prior to 2016, there were certainly studies on brain function or long-term meditators. And one of the questions was, well, does this happen, when you practice for a shorter period of time? And 21 studies looking at brain function indicates that the emotional and behavioral changes that people report after participating in mindfulness-based programs are related to both functional and structural changes in the brain. So that neuroplasticity can take place in, as short as 8 weeks. I am not a neuroscientist, so that's just a disclaimer right away, but just to tell you that what has been shown is that in the prefrontal cortex, the cingulate cortex, the insula, and the hippocampus, there has been shown increased activity, increased connectivity, and volume changes in stressed, anxious, and healthy participants. Now, these areas of the brain, prefrontal cortex is about higher cognition, cingulate cortex is involved with emotion regulation, the insula with more kind of inner awareness and so forth. So it correlates with what the reports are of participants. Additionally, the amygdala showed decreased functional activity, improved functional connectivity with the prefrontal cortex. Again, this is, and we've heard about this, is in, better emotional regulation and so forth. We just actually published a paper on functional brain activity in older adults, which is interesting for me to say these days, but in actuality, the mean age was 80, and these people trained with us in MBSR, and the type of changes that are here that we're reporting, they occurred in these people 80 years old. Pretty, it's amazing.
Yeah.
Amazing. So, there's this evolving research on mindfulness-based interventions and immune system function, and this is, randomized trials over 4,500 people looking at 6 immune-related biomarkers, and basically showing benefits, reductions in inflammatory markers, that's C-reactive protein, interleukin, an increase in T lymphocytes, cellular immunity, and also an increase in telomere length. And the telomeres are actually little caps on top of the DNA, the chromosomes. And as a cell ages, they get shorter and shorter. And basically, the length of the telomere has been associated with like health and also aging. So this is a lengthening that takes place. So these findings kind of begin to show that the potential for improving immune function is one thing that might be impacting somatic disorders, the benefits in somatic disorders. I recently just gave a presentation to women with advanced stage cancers, and I wanted to bring this in for them, and I thought I'm bringing this slide in because this is, we speak about healing, and yes, I can talk about immune system function, I can talk about brain, so forth, and there's much, much more. And so this is health outcomes of mindfulness-based interventions for cancer patients and survivors, over 4,000 people. And the studies showed improvements in several positive health outcome domains: mindfulness skills, self-compassion, positive affect, the ability to cope with what they're dealing with, improved social support, improved well-being, personal growth, and spirituality among the people, the cancer patients and survivors. And I'm going to move away from the slides right now and invite you to as well. As science is very important, I don't think I would not be sitting here right now. If Jon Kabat didn't do some science way back, and all these people are doing it, and it helps bring people to programs and so on. But I'm also a teacher, mindfulness teacher. And for me, hearing and seeing what people go through in the programs really, what's the word? It's palpable, the healing. So I have a few statements that people have made who have taken some specialized programs. I run a program for people who are dealing with amyotrophic lateral sclerosis. If you're familiar with this, it's ALS. It's Lou Gehrig's disease. It's a fatal disease. Fatal disease. Once you're diagnosed, average lifespan maybe 2 years, maybe 3. And you lose all control of bodily movements, basically. And I was asked to come in and see if there's anything I can do to support these people. So I run a 6-week program for them, and it's adapted. It's not MBSR, but it's mindfulness, right? So just want to say that there was a man who took the program, quadriplegic, no movement, breathing tube, feeding tube, right? Now, just notice what's coming up for you in the moment. And at the same time, as much as possible, stay open to hear what he is saying here. I wanted to let you know this past week, on Thursday night, I was really having a bad panic attack. The first one I've had in a very long time. I was having trouble breathing and my pulse was over 130 when it's usually 60. So while my wife and nurse were getting some medication ready, I decided to listen to the first week's recording. This is a meditation, a body scan recording. Before they could even get the medicine into my G tube, my feeding tube, I was already back down under 80 and feeling better. Just thought, want to know. Another man from the program. When I started, I felt each time I would look backwards at all I had lost. But by the end of the program, there's such a huge change from all the things I'm missing to all the things I have. The research, it doesn't quite get to some of this, right? And this is the same person who actually was helping Jefferson medical students design a neck brace for people with ALS, because often they need support. And he mentioned this at the beginning of the program, that they're struggling so much. Amazing to me, this is what he was doing with his life. And they could not figure this out, how to design an engineer. He was an engineer by training. And in one of the classes, we were practicing, meditation. And afterward, it was like a light bulb went off. This man, it was like shining bright light. I didn't know what was going on. Mm-hmm. And he announces to everybody, "Oh my God, I got it. As clear as day, I know how to design this." And then he says, "It's truly amazing what happens when you can let go of the chaos of the mind." And then I'll end with this, and that is a special program that we ran at Project Hope, which is a clinic for the homeless. And it's for chronic pain management, people who are on opioids, trying to get off opioids and so forth. And in all honesty, they didn't think that people would show up, but people really did show up. And this is what was reported, not everyone, but enough. With this practice, I can focus on the pain where it is, and sometimes it actually disappears. I'd rather do that than take morphine. I don't like to take narcotics, even though I have them 24 hours a day. I'd much rather pop in the CD, we gave him CDs and CD players, and do the meditation. And this class has given me tools that I don't have to take narcotics as often. And one final statement. A woman in that class wrote, I have 3 words: open-mindedness, willingness, and acceptance. I got this mindfulness program at a time where I really needed this. The class has been truly liberating. I have a deeper level of self-acceptance. Healing. Thank you very much for your attention.